Good afternoon, everyone. If you are in the UK, or good morning, good evening, depending on where you may be in the world. My name is Andres Velasco. I'm the Dean of the School of Public Policy, and I want to welcome you to this event, co-sponsored by the school and the LSE Public Policy Review. This is a journal started a couple of years ago by the School of Public Policy and by the Beveridge 2.0 initiative within the LSE. And the purpose of the journal is to bring together leading scholars from the LSE and from other universities to focus on public policy problems of immediate relevance to the country and to the world. And of course, over the last year and a half, there's been no more pressing issue than the pandemic. So the journal put together, under the leadership of Professor Adnan Khan, who's here with us this afternoon, a special issue on bringing social science to bear on the policy response to the pandemic. The issue is a very good one, and you will get a sense of how good it is because we have three of the authors. It's a larger issue, but three of the authors whose papers are published in the issue are with us this afternoon. And I think we're going to have a great discussion. We're also very lucky to be joined by Professor Ricardo Hausmann from Harvard, who will be the policy respondent to some of the policy proposals that will be discussed here this afternoon. So again, thank you very much for joining us. We're very lucky to have Professor Tania Burchardt, who will be chairing the event this afternoon, and I'm going to hand it over to her. Thanks very much.
Thank you, Andres. So I indeed am Dr. Tania Burchardt. I'm an Associate Director at the Centre for Analysis of Social Exclusion and also a member of the Commissioning Board for the LSE Public Policy Review. I'm very pleased to welcome our speakers and policy discussant today, Professors Francisco Ferreira, Lucinda Platt, Adnan Khan and Ricardo Hausmann. Before I hand over to them, I have a few brief announcements. For Twitter users, the hashtag for today's event is LSE COVID-19. Please feel free to tweet. The event is being recorded, as you will have seen, and live streamed on Facebook. And barring any technical difficulties, we will make it available as a podcast afterwards. After the presentations, we will hand over to you, the audience, for Q&A. So you will see the Q&A function at the bottom of your screen. Hover if it doesn't immediately appear. Please use that to post your questions and comments for the panel. Those will come through to me as chair, and I will try to put as many of them as I can to the panel towards the end of the event. If you can, please remember to put your name and affiliation as part of your question. That would be very helpful. So as Andres said, this event forms part of the LSE's Shaping the Post-COVID World initiative, which is a series of debates about the direction that the world could and should take after the crisis. In some ways, you may feel it's a little premature to be talking about after the crisis, since we are clearly still very much in the crisis. On the other hand, now probably is the time to be thinking forward to the time when we emerge from the crisis and what we want to be able to put in place in order to make that a better world. The event also, as Andrea said, part of the Beveridge 2.0 initiative and programme, of which the LSE Public Policy Review forms a part. The latest issue of the review is now available, and we've put the link to that in the chat. And in addition to the three contributors who are speakers today, there are many more contributions to that special issue on COVID-19, which I very much encourage you to take a look at. Our speakers have been asked to speak for no more than 10 minutes each, which is a tough assignment given the richness of the articles on which they're drawing, I happen to know. And they'll be followed by our fourth speaker, Ricardo, who's been invited to respond to their contributions, particularly from a policy perspective. That will leave us with around 45 minutes for the Q&A. So again, please don't hold back from posting your questions and comments in a Q&A at the bottom of your screen. We're very keen to hear your thoughts and reactions today. The event will conclude at 5:30, but unfortunately Ricardo has to leave at 5 o'clock to chair another event. So make sure you get your questions for Ricardo in early so that we can make the most of our time with Ricardo. I will introduce each of the speakers in more fully in their turn. First up is Francisco Ferreira, also known as Chico. He is the Amartya Sen Professor of Inequality Studies and Director of the International Inequalities Institute at LSE. Chico is an economist working on the measurement, causes and consequences of inequality and poverty. Chico, I might just ask you to mute until I hand over to you, just so we don't get the echo. Chico's work focuses on developing countries in general, but Latin America in particular. And some of his recent work has been on equality of opportunity and inequality of opportunity and its measurement. Chico was born and raised in Sao Paulo in Brazil. He came to LSE for his PhD, following which he had a long career at the World Bank, mostly in the research department, as well as teaching at the Catholic University of Rio de Janeiro and at the Paris School of Economics. We always hoped that he would return to LSE, and we were delighted when he accepted the position of Director of the International Inequalities Institute last year. Chico is going to be talking about death and destitution, the global distribution of welfare losses from the COVID-19 pandemic. I'll hand over to Chico to share his slides with you now.
Thank you very much, Tania, for those very kind words, and to Andres and Adnan and everyone else for the invitation to be here. When we were testing the slides earlier today, there was a lag in my slides. I hope it's going to be better now, but if not, I hope you just bear with me. I won't be able to take very long because, as Tania said, we only have 10 minutes. So hopefully you can see my screen. Can Tania, can you see my screen? Very good, okay. So the paper is called, as Tania said, Death and Destitution. It's a sequel to an earlier paper called Lives and Livelihoods. And it's on the global distribution of welfare losses from the COVID-19 pandemic's joint work with Olivier Sterck and Daniel Mahler and Benoit de Cerf. So the basic idea of the paper is to quantify and compare losses in social welfare arising from two channels of the pandemic: mortality and poverty. And this is not exhaustive. You know, there are other effects of the pandemic, say on education, on health outcomes and suffering that doesn't lead to death. So there are lots of other sources of welfare effects, but we thought we'd focus on these two: mortality and poverty in particular. And here are the two photographs, both from Latin America, illustrating that. More specifically, we thought we'd address two questions. The first one is on the relative importance of those two sources, mortality and poverty. What was the relative contribution of increased mortality and greater poverty to the welfare losses caused by the pandemic? And did this vary significantly, or did this vary systematically across countries? So that's about the relative importance. And then the second one is, if we could aggregate those two sources of well-being or of loss of well-being, mortality and poverty, how were the aggregate welfare losses, arising from the sum of those two components distributed across countries? And of course, the sort of standard empirical challenge with this is one familiar to all the economists working on these things, which is that economic costs are typically measured in monetary units and mortality costs are typically measured in numbers of lives lost. And economists typically combine the two by assigning a monetary value to human life. And this is often an issue in public debate where many people we had a quote in one of the papers by Andrew Cuomo when he was mayor of New York, and he said to the press, A human life for me is priceless, period. And so, that was something we're trying to avoid here. I want to highlight here that our data for this paper was current as of the end of last year, in order to be in this issue of the journal. But of course, quite a lot has happened since, and I'll come back to that briefly at the end. So our idea was to avoid trying to put a price on human life, as you do, for example, in the value of a statistical life approach. And we try to sort of change metrics. So our approach is still anchored in models of social welfare that aggregate, expected lifetime utility over periods of a person's life and over individuals. But by making a few assumptions to the way we write the model, we shift the metric from a money metric to a metric of years of human life. In particular, years of human life either lost to mortality or additionally spent in poverty. And the one equation I allow myself to show you here is one that says that the change in welfare that we try to estimate can be expressed, on the basis of our model in terms of a sum of life years lost and added poverty years with a welfare weight alpha, which is the key normative parameter in our framework, which captures the kind of welfare weight of a life year relative to that of an additional poverty year. And we think of it as the answer people might give on average to the following question: how many years would you be prepared of the rest of your life to spend in poverty in order to add 1 year to your lifespan at the end? Okay, so that's this alpha. Obviously, people's answers will vary depending on their age, their income, how far they are from the poverty line. But some average of that might be the societal value for alpha. Okay, so with the time we have, we'll go very quickly first through these two ingredients. So let's look at life years. So here's for 145 countries that we had in our data, by December 2020. A plot of live years per 100,000 people lost to the pandemic. And two things that I'd like to take away from these life years. This is just the first component here, life years. The colors here are for low-income countries, lower middle income, upper middle income, and high-income countries. Note that the scale is logarithmic on both axes. So this is a hugely upward slope. A sloping line here going from 1 to 1,000 years lost per 100,000 people. So you see that middle income, higher middle income, upper middle income, and rich countries had by far the highest mortality burden measured in terms of life years. And that is for two basic reasons. One, COVID is highly age selective, and these populations are much older in these richer countries. And the other is that we're adding up life expectancy lost, and that life expectancy, even conditional on age, is higher in richer countries. So that's fact one to take away from this graph. Fact two is that despite the very big slope, there's also huge variation at any level of income, suggesting that either circumstances or policy responses can make a very big difference. Amongst middle income countries, you have Peru and Brazil and some countries in the Balkans here, North Macedonia and Bosnia and Herzegovina, at 1,000 live years per 100,000 people, and you have Thailand at roughly the same income level at about 1. Okay, now there are lots of caveats, lots of data issues, lots of reporting issues that we don't have time to discuss now. We can discuss them hopefully in the question and answer session. But that's ingredient one. That's mortality, and you can see this upward sloping pattern. With poverty, you basically get, obviously, as you'd expect, the reverse sloping pattern. The costs in terms of poverty at a fixed poverty line are much higher for poorer countries than for richer countries. However, if you adopt a more relative approach and you use specific poverty lines for each country's income class, so one line for low income countries, one for lower middle income, one for upper middle income, one for high income, that relationship kind of disappears, and the economic cost measured only in terms of poverty is actually more or less constant across the world. Okay, so let's try and answer those two questions. What about the first one? Was about, remember, the relative importance of deaths and destitution. So we just take these poverty years here and these life years here, and we take the ratio of them There's no alpha here. This is just for each country, poverty years over life years. Okay, so it depends on your alpha. If your alpha is, let's say, 20, that's this upper line here. That means for you, you're prepared to spend 20 years in poverty in your country to add 1 year to your life. Then all of these countries over here are countries where the poverty years to life years ratio is higher than that. So poverty is actually the dominant source of welfare loss. And to the ones below these lines, mortality is the dominant source. Some of my co-authors in another paper did a survey of this, and the average answer people gave in 3 countries, the UK, Australia, and the US, the US, Australia, and South Africa, I believe, was 7, but that's a different survey in a different paper. You can take whatever you want. Here's a guidance range, 5 to 20. In all these countries up here, poverty actually was a bigger source of welfare loss than mortality. So that was question 1. Now, question 2 is, if we can agree on an alpha, so far we've been agnostic about alpha, but if we can agree on an alpha, can we look at the aggregate welfare costs? Those are actually going to depend, how the aggregate welfare losses of the pandemic are distributed across countries will depend in our very simple framework on 2 things, whether you use a single constant poverty line or a more relative one that varies across countries, and your valuation of alpha. And I'm going to show you graphs for alpha equals 5, which places relatively low value on life relative to poverty, and an alpha equals 20, which places a higher value on life relative to years in poverty. And here are the results. So this one is for the constant absolute poverty line, the very stringent global poverty line the World Bank uses, $1.90 a day. At that poverty line, if you choose an alpha of 5, so you say, well, it's only a year in poverty is very bad, and you need 5 of them to be worth 1 year of life lost, 1 year of life, not 1 life, 1 year of life lost. Well, then you actually get that despite the mortality burden being much higher in richer countries, the welfare cost tends actually to be higher amongst poorer countries rather than the reverse. But that's the only case in my 4, in my 2x2 matrix here. That's the only case in which you get that. The moment you get to a higher valuation of a year of life relative to poverty, that slope becomes positive. And if you use relative poverty lines, a poverty line for each country category here, again, these are upward sloping lines, suggesting that despite having much better health systems and just better social protection systems and being generally richer, these richer and middle income countries over here suffered more than the poorer countries because of the age selectivity of the pandemic, right? So I'll end with this slide, just summarizing briefly some of the things I've already said. First, the mortality burden of COVID-19 is borne disproportionately by middle income, largely Latin American, but also some countries in Southern Europe, middle income countries and richer countries. And this is because they're older and the virus is highly age selective. Conversely, the poverty burden was borne disproportionately by poorer countries. If you use a constant poverty line, less clear pattern if you use a weekly relative poverty line. Globally, unlike the debate in many of the newspapers and the media in richer countries, which have focused on mortality because mortality was the most important cause of welfare loss for them, poverty consequences have actually been a first-order cause of welfare losses from the pandemic. Even with a high alpha, poverty turns out to be the dominant source of welfare loss in 70 of our 145 countries, and obviously more if you use a lower alpha. So I've already said these things. I'm just going to end with a little caveat. This was by December 2020. 2021, we can speculate with some degree of confidence to have made aggregate results worse because the pandemic continued to be very severe. And likely the distribution of losses more skewed against poorer and middle income countries where vaccines are being distributed much more slowly and ineffectually than in richer countries. So thanks very much for that. I'll stop sharing here. Thanks.
Thank you, Chico. Thank you very much indeed. And I'm sure there will be lots of questions that people want to put to you, both methodologically and in terms of your very interesting results and conclusions, and indeed the implications of those conclusions. I encourage people to use the Q&A function, and we will return to pick those up after the other speakers have made their contributions as well. So we turn now to our second speaker, Professor Lucinda Platt. Lucinda is Professor of Social Policy and Sociology and Head of the Social Policy Department here at LSE. She joined the department in 2013 from UCL Institute of Education, where she was director of the very important Millennium Cohort Study. She is also a co-investigator on Understanding Society, the UK Household Longitudinal Study, leading for that study on ethnicity and immigration. Lucinda's research focuses on analysis of inequality within and between social groups, both in the UK and internationally. She also works on identity and intergroup relations, and on child poverty and child development. She's currently a panel member for the IFS Deaton Inequality Review, for which she recently co-authored a study investigating ethnic inequalities in vulnerabilities to COVID-19. And it's that subject that she's going to talk about today, drawing on her article for LSE Public Policy Review. Over to you, Lucinda. Thank you.
Thank you very much, Tania, for that kind of introduction. So yes, I'm going to be drawing on both pieces of work that Tania mentioned there. The work I did last year with Ross Warwick on ethnic inequalities in COVID, and the paper I've done for the review, but also trying to sort of make some broader reflections, not just replicating either of those pieces. So Chico just discussed impacts of the pandemic in terms of mortality and poverty. So health costs and economic costs you might think of, and how they don't necessarily, it's shown how they don't necessarily follow the same pattern. In my comments that follow, I'm going to be talking about health and economic impacts as well, but not across countries, across ethnic groups and within a single country. So I'm going to be focusing on the UK here. So in the UK, one of the earliest and potentially most startling inequalities in the impact of the pandemic was observed differences in mortality across ethnic groups in the UK. So in one of the earliest analyses on this topic, Ross Warwick and I found that death rates from COVID-19 were substantially higher for minority ethnic groups than would be expected from their age and sex and geographical profiles. For example, for Black Africans, they were 3.7 times what would be expected. For Pakistanis, 2.9 times, and for Black Caribbean, was 1.8 times. So some quite substantial differences in mortality. Subsequent research endorsed these findings and ethnic mortality differentials for South Asian and Black groups. And these were also shown to persist across second wave. So our analysis was clearly on the first wave, but these ethnic differentials in mortality were shown to persist into this year. Though there was some variation, the groups most affected in the second wave were the South Asian rather than the Black groups. So there's been a huge amount of research that's been trying to identify and understand what's been causing these mortality differences. And we have gained some greater insights, and I'll refer to some of those as I go along. In the work with Ross, however, we also looked at the economic consequences of the pandemic and how these differed across ethnic groups. So we found that Pakistani and Bangladeshi men were much more likely to work in the sectors that had been shut down as a result of the pandemic. They were also more likely to be self-employed, who were a group that were identified as being particularly vulnerable to the economic impacts of the pandemic. But interestingly, what we showed was that for these men, it was those who were in midlife rather than youth who were most likely to be affected. Whereas across the population as a whole, what was identified was that it was more likely to be youth who were affected and to some extent women rather than men. So the result of this, that these were men in midlife, was that the family circumstances of those affected were quite ethnically specific. So these midlife workers were more likely to be living in couples and not necessarily with second earners who might buffer the effects, these economic effects. For example, we showed that 29% of Bangladeshi working age men both worked in a sector that was shut down by the pandemic and had a partner who was not in paid work themselves. So you can see that immediately the impacts on both members of the couple. 29% of Bangladeshi working age men were in the situation. This compared with 1% of white British men being in this particular situation. So quite big differences. And again, we were using data that preceded the pandemic to sort of infer what the effects of the economic effects of the pandemic were, but subsequent research has demonstrated that there are have been differential impacts across ethnic groups and that are consistent with our findings. So when thinking about ethnic inequalities in the impacts of the pandemic, both health and economic impacts warrant attention. And indeed, I think the factors that lead to them can be seen as interlinked. So in the review paper, I start from the position that both health and economic impacts can benefit from being understood more in relation to the household context. So the household context can both exacerbate exposure to health risks and have implications for economic impacts, as I've briefly illustrated. And that we need to pay attention to occupational concentration, so where different ethnic groups are working or working to a larger extent. And again, these can be linked to both to health risks and to economic consequences. In addition, I think a further key question we need to think about is to what extent are we seeing immigrant inequalities in these differences across ethnic groups, and to what extent are they ethnic inequalities? And I'll just say a little bit more about what I mean by that. So by immigrant inequalities, I refer to the factors that are associated with experience of immigration itself, factors that may then shape work and living arrangements. For example, recruitment into particular occupations or sectors, immigration controls that shape the possibilities of work and also that shape the possibilities of not working if there's no recourse to public finance, if there's no recourse to out of work support, financial support. Immigration is also associated with, at least initially, migration into particular areas that tend to be areas that have migrant concentrations. And housing options tend to be much more constrained for immigrants in the UK. And again, particularly for more low-paid workers and for those without the possibility of accessing social housing, for example, because of immigration restrictions. By contrast, by ethnic inequalities, I'm not, I would emphasize, invoking biological explanations, but instead I'm thinking about the ways that there is persistence across generations from those of the same countries of origin, not only in group identity, but also in terms of experiences and activities. So living arrangements, what sort of jobs they're concentrated in, and areas of residence. Such persistence would suggest kind of some sort of sense of groupness of those of both the first and second generation from a given ethnic origin, by contrast with the break we might expect between immigrants and the second generation, if what we're talking about was an immigrant experience. And within this idea of ethnic inequalities, I also include the experience of racism and discrimination, racism and discrimination focused on ethnic origins rather than on foreigners per se. So the persistence of group level stereotypes that encompass both the immigrant and the UK born. So that's my starting point. So how does this help? What do we observe when we take a household, occupational and generational perspective on ethnic inequalities in the consequences of the pandemic? And how far do we see connections between the consequences for health and the consequences for income? So just thinking through it, risks of exposure to infection can take place in the workplace, but they can also take place in the home. And the two are interlinked, of course, when people cohabit. When people living in a household cohabit with someone who is exposed to their work, and also when people who get infected are then exposing others in the household who need to care for them. And we know that a number of ethnic minority groups are more likely to live in multi-generational households, and particularly more likely to be living in overcrowded housing, which clearly creates challenges for social distancing in the home when such exposure leads to infection. And we know that the occupations that some minorities work in are much more likely to be key worker occupations and have higher risks of infection and higher risks of mortality themselves. And so then there's a risk that they're bringing these home. So I think you need to think about that, that infection risk, those mortality risks very much in a household perspective to fully start to understand them. And there has been some analysis which has shown that multi-generational larger households or overcrowded households, different measures have been used in different analyses, do explain some differences in mortality. We also know that health risks are higher among certain ethnic groups and are potentially less well managed. So there's sort of the relevant health risks for COVID-19. And the level to which they're better or less well managed and the extent to which there are comorbidities put these groups at greater risk of greater severity of the disease and therefore for given infection of mortality. And we know that these health risks themselves may stem in part from discrimination and economic inequality. We know about the health impacts of poverty and inequality, and we know about some of the health impacts of the experience of discrimination. And these together may increase this vulnerability to COVID. So again, you can't really separate out the health and the poverty experience. Ethnic minorities, particularly certain ethnic groups, are more likely to work in sectors that are subject to lockdown, as I've shown. But then is this, as I've said, is this an immigrant issue, as immigrants are recruited and clustered in particular occupations, or is it a wider ethnic group issue as occupational transmission across the generation and the inequitable structuring of the labour market concentrates groups in certain occupations, both in the immigrant and the second generation? And from the research I did, the answer seems to be both are true to some extent. There is greater occupational concentration in the immigrant generation, but there's also an interesting level of occupational transmission across the generations. And there is still higher levels of occupational concentration in the second generation, the UK born, than there is in the majority population as a whole. So just to give one example, 17% of UK born Indian men are in the jobs that the top kind of 5 jobs that these men are in, compared to 10% of white British men, and 27% of UK-born Bangladeshi women are in their top 5 jobs, compared to 19% of white British women. And thinking about this issue of persistence that we see the same sorts of occupations turning up in the same 5 across the first and second generation. So perhaps one of the most striking examples is that 20% or over 20% of first generation Pakistani men are taxi drivers. But even among the UK born, the proportion is 8%. So 8% in a given occupation is a really high share. And we're seeing that there's same occupations. So how am I doing for time, Tania? Have I got a couple more minutes?
1 minute would be ideal.
Okay. So occupational continuity, I think, across generations can then be understood both as a symptom of structural inequalities that shape and limit access to particular occupations, but can also help us to understand within family occupational transmissions that shape the group experiences across the generations. And what we also see when I look at families, and I'll keep this very brief given my 1 minute, is that when you look at family structures and the organisation of family structures, that you also see similar patterns of intergenerational transmission of family structures, which means that those groups who have, for example, larger households or more likely to have single parent households in the immigrant generation, we see the same patterns in the second generation, suggesting that these are that we need to take seriously this sort of groupness, and that these are issues which persist across the generations, even if we're also seeing some generational change. So I think we need to think about, in conclusion, how the structuring of the labour market consigns some roles to immigrants and consigns some roles more than others to immigrants, and that these have consequences not just for the immigrants, but in the longer term and how that social structure is organised. And these combine there thus with processes of intergenerational transmission and processes of labour market and economic exclusion across the generations. And these processes of exclusion themselves then heighten health risks. And this altogether means that we can't separate COVID-19, the impacts of the pandemic, discretely into health and economic impacts, but we have to think about how they're mutually implicated. And I'm not going to say anything about policy implications now, because I'm going to save that for the questions, and I'm going to hand back to Tania. So thank you very much.
Thank you very much indeed, Lucinda, and sorry to rush you a little, but as you say, I hope we'll be able to come back to some of these issues and the policy implications in the Q&A. Indeed, there are already questions coming in, which is great. I'm going to hold on to those until the end. Keen in particular that we don't cut Ricardo too short because of his need to leave us, unfortunately, at 5 o'clock. But first, I want to introduce Professor Adnan Khan. Welcome. Professor Khan is Professor in Practice at LSE's School in Public Policy. Before joining the School of Public Policy, Professor Khan served as Research and Policy Director at the International Growth Centre here at LSE, and he also taught public policy at Harvard Kennedy School. He spent more than 15 years in the policy world as a practitioner, policymaker, and activist, and more than 10 years in the research world as researcher, lecturer, and catalyst for other people's research, as well as his own areas of interest in economic development, state capacity, political economy, state fragility, and public finance. He's therefore especially well placed to reflect on how well or badly states have prepared for and responded to the COVID-19 crisis. And it's that subject that he's going to address today. Over to you, Adnan.
Thank you for the generous introduction, Tania. So let me start sharing my screen. I hope you can see this. Yes. So this is joint work with colleagues. Our focus is on developing countries and emerging economies. And we're talking about like preparing lessons from the COVID-19 experience in preparing for crisis. I spent a lot of time working for governments, and let me start with the word of praise for government responses in most of the countries. I think a highlight of my experience in working for governments is that we were always working in firefighting mode. And that we realized that governments could only function at high levels for very short periods of time and over very small geographic areas. So one must appreciate most of the governments, though maybe not all, in that they have risen to the challenge and have functioned at high levels over wide geographical areas for long periods of time. However, there are things that governments could have done differently, which could have improved outcomes. And we'll be talking about some of those lessons with a view that they could help address some of these underlying challenges and help us prepare better for future crises, and ideally help build greater state capacity in general. So I'll talk about three issues here. One is the issue that at least initially, the response of many governments was, we have limited knowledge, we are flying blind. We either need to copy from somewhere else or do something else. And I would say that the government response, the state response in many places was hampered less by lack of knowledge, but more so by limited understanding of how to acquire relevant knowledge and capacity. In other words, learning to learn is a key feature of state capacity. And there was a lot of prior existing knowledge and information that governments could have brought to bear in terms of their policy response. And I'll show you a couple of examples of those. The second, when talking especially at developing countries and emerging economies, is what I would call siloed approaches and limited collaboration and coordination. So first, between academic silos, we talk a lot about like multidisciplinary work, but when it comes to crisis, not many disciplines have been talking to each other, especially in developing countries, despite the challenge being such that it requires people from expertise from different disciplines working together. I can give you many examples of those. One of those being, we have great EPI models that are great as a starting point, but that do not incorporate uncertainty and behavioral responses, at least in their initial attempts at modeling. And that could benefit quite a lot by working with expertise from other disciplines, and similarly, other examples also. When you look into responses of governments, we also see in some places at least absence of mechanisms to coordinate among different agencies. So different agencies and different government players often working at cross purposes and at worse. Sometimes we also see, and the paper has many examples of those, of cases of unhealthy competition where policy actors are trying to avoid blame by passing on blame to other actors. And obviously that's not very conducive to building an effective policy response. Similarly, when it comes to, call it politics, what we see is a temptation for political leaders to, what Bowen and Arjun in a parallel article in the same volume put it very nicely, to go big and do it fast. That's what we saw in the first stage of the pandemic. Unfortunately, in the second stage, at least in some parts of the world, South Asia, maybe Latin America, what we also see is a sense of exceptionalism and maybe complacency that has come back to haunt, unfortunately, many regions of the world. What we also see is states with limited trust have not been able to achieve much in terms of voluntary compliance. And in another volume, in another paper in the volume, Tim Besley and Sasha Dre argue that countries with higher interpersonal trust and higher confidence in government have fared better. The paper provides more examples of these. And here are some examples of how we could use more information. This comes from Delhi. This comes from variation in risk of hospitalization, which is based on age, sex, hypertension, diabetes, and smoking across different areas in Delhi, different neighborhoods, with the areas in red obviously being more risky, with a view that such information, which is already available, could be used to have better targeted lockdown and other strategies, with the caveat that one needs to have policies that do not exacerbate underlying inequalities. Here is another example of that. Here is the age distribution in Pakistan and Italy, and you can see how widely different those are. Italy has a lot more people in the more aged category compared to Pakistani population, which is far younger. If you look into their spatial distribution, urban, rural areas, occupational choices, mobility patterns, risk profile, disease progression, there's a lot of information that is already existing that one could use in order to design smart containment strategies, something that we did in working with several governments and planning such measures, which are based on smart gridding, geographical targeting, grading in terms of different levels, and also based on the principles of active learning, something that I will quickly discuss. So my last couple of slides, I am cognizant of the time. What lessons do we draw in terms of how states should do better in future? Three things: adopting an active learning mindset, preparing data infrastructure for crisis response, and improving coordination, building state capacity and trust. And let me say a word about each of those. An active learning mindset, we are not flying blind. We have a lot of prior information, but we could also take actions that not only are effective now, but that also speed up the learning that we need, and so that we refine actions based on actively gained knowledge. In other words, act in a manner where we not only respond, but also gain more knowledge that we can then use to refine our response. Something that social scientists know for a long time, decision-making under uncertainty and using that knowledge and those approaches in terms of active policymaking, what we call with an active learning mindset. Second, preparing data infrastructure and capacity for crisis response. My experience in working with governments, every time a crisis emerged, there was a lack of coordination, but also following, say, an earthquake, everyone wanted to go to with relief to the first village that came along the way. And the response was often not based on the heterogeneous needs of different places and coordinated between different actors, I would say public actors, private actors, and not-for-profit actors. And now today that we have a lot of data sources, not just the traditional census type of data, national data, we also have administrative data, all of those could be digitized. We have geospatial data, and we have private sector and citizen-generated data, like say cell phone data and mobility data. And all of these data sets, along with appropriate caveats for privacy, could be integrated to create data infrastructure that could then be, along with those, one could create protocols to activate, access, and revise these data sets and different layers of these data sets in real time. These could be activated in times of emergency. Along with that, one could also create flexible plans based on our existing knowledge, but which already incorporate elements of how do we update those based on real-time knowledge, and also create new structures that are flat, flexible, and that are also fast. And that also incorporate different kinds of expertise, call them authorizers, mobilizers, but also implementers. And it's not just the developed countries and OECD that provide good examples of doing that. I can share some examples that I myself witnessed from Sierra Leone and Liberia, which created such fast, flat, and flexible structures to deal with the Ebola epidemic a few years ago successfully. Lastly, coming back to politics, my last point, improving coordination, capacity, and trust. It's important to create structures that whereby we share different government agencies and policy actors, share credit for policy innovations, and more importantly, mitigate blame for failures, something which is very common in policy organizations, and to creating a norm where failure is seen as an opportunity to learn and not an opportunity to assign blame to someone, because that hinders innovation and cooperation and coordination. Adopt pragmatist, not big decision approach. Again, Bowen and Lodge put it very well. And promote common purpose in order to increase trust in the state that could then be used to have more voluntary compliance and do more. My colleague, our colleague, joint colleague, Tim Besley has written quite a lot about this in this volume and elsewhere. Let me stop here. Thank you.
Thank you very much indeed, Adnan. I'm sure people will want to come back on the implications for handling of future crises based on what you're saying. Let me turn straight away now to our policy discussant, Professor Ricardo Hausmann. Thank you very much indeed for making the time for us today. Professor Hausmann is Rafik Hariri Professor in Practice of International Political Economy and Director of the Growth Lab at the Harvard Kennedy School. Previously, his many roles, probably too many for me to enumerate right now, but let me just highlight the being chief economist of the Inter-American Development Bank, where he created the research department, chair of the IMF World Bank Development Committee, Minister of Planning of Venezuela in the early 1990s, member of the board of the Central Bank of Venezuela, as well as professor of economics in Caracas, where he founded the Center for Public Policy. I could go on, but I won't. Ricardo is ideally placed, I think, to respond to the contributions we've heard so far from both an academic and a policy perspective. Over to you, Ricardo. You're still muted. There we are. Thank you.
Well, first of all, thank you very much for this invitation. I'm in awe of the dynamism that LSE is showing. So congratulations for this incredible work and for putting this volume together. I learned a lot reading about it. So, and I have, I'm going to highlight the many things I learned while reading it, but also to say something about, some reflections that these papers have created, have caused on me. So I'm going to preface by reminding ourselves that when asked in the 1970s, in the early 1970s, Chou En-lai was asked, what was his opinion about the French Revolution? He said it's a bit too soon to tell. And I think that that's an important reflection, because we are not analyzing COVID as a done deal. We are analyzing COVID probably towards the end of the first half or so. But very early in the process of this pandemic, and it's hard to, it has some implications. It's hard to derive too many lessons before you've seen the whole story play out, but also the importance of figuring things out, because there's still a lot of game to play. This is not a done deal. Whatever we learn now is going to be incredibly useful, because it's still an active game. So this, with this preamble, I want to say, let me tackle the three papers. I found Chico's presentation and paper beautiful. I find his decomposition of the welfare effects very compelling. I like his idea of measuring things in years of life. I think it's more intuitive than in dollars, and it's more meaningful than in dollars. I think he's very careful in analyzing the welfare implications of different things, and take your pick of your alpha, then what you want to say. But he ends up with arguing that in the end, for most valuations, it seems to have been a crisis that hurt more the richer countries than the poorer countries. And I want to take a little bit of issue with this last conclusion, precisely because of this Cho in live phenomenon. And I'm going to make the following claims to see if you agree with me. There is no such thing as a long-term success against this virus other than immunity. That it's not that, if you have a more coherent society with more trust, this, that, and the other, somehow you're going to keep the virus at bay, except through immunity. And there's only two ways of getting immunity. One way is to get sick and survive, and the other way is to get vaccinated. But except for those two mechanisms, there's nothing about social distancing, social trust, and in the long run is going to beat this virus. And the success we have today in controlling the virus only increases the size of the susceptible population tomorrow, and makes you more vulnerable tomorrow. And a really dramatic way of presenting this is to compare Spain to Uruguay. Last year, everybody was talking about how Uruguay was so cohesive and stuff, and so different from Argentina, and so different from Spain, and what can we learn from Uruguay? Well, there was nothing durable to learn from Uruguay, because they were successful at the beginning. When they got infected with a more transmissible variant, they got into world record levels of infection and death. And so my sense of this is that all the countries that have had relatively low deaths, maybe because they are less connected to the world, there's less international travel, there's less mechanisms for the virus to get in, but in the long run, the virus gets in and does its thing. So I think the death rates of the year 2020 are a poor indication of the long-term deaths that this virus is going to create. Now, in addition, I would say it's very interesting that there were dramatic recessions in 2020, and very much so in the countries that Chico identified. But we need to think about the long-term consequences of the shock. And Chico used in his paper the projections of the World Bank. I'm going to, because I didn't have them at hand, I used the projections of of the IMF and ask myself, okay, does the IMF think is going to be the GDP in 2024 of countries relative to what they thought the GDP in 2024 was in their World Economic Outlook of 2019, so before the event, okay? And for the IMF, they think that the GDP in the US is going to be higher than they thought was going to be before the pandemic. So it's more than a V-shaped recovery, it's an over-recovery. The difference in China by 2024 is more or less insignificant. The difference in Latin America is 7 percentage points of GDP in 2024. The difference in South Africa is 8 percentage points of GDP. The difference in India is 12 percentage points of GDP. So these losses are going to be longer term. So I'm a little bit concerned that as we make obviously, thanks to Chico's paper, we will be able to do his calculations later on. But my sense is that we have set ourselves up for a situation in which the rich countries will have vaccinated themselves by 2021, that their economies will be recovering, and that the rest of the world, most of it, will still be battling the virus in 2022 and 2023, and that they will be fighting with non-pharmaceutical interventions that will come at significant economic costs, and that this is going to build up. So as I said before, we are in the first half of the game, and these losses are going to change significantly. But thanks to Chico's paper, we have a way of thinking of what these numbers are going to be down the road. I think Lucinda Platt's paper was really, really eye-opening and really concerning about these huge differences in mortality by ethnic groups. And obviously, I mean, it's very well done, and the differences between the first generation and the second generation, but she highlights some of the transmission mechanisms. Obviously, she puts a great emphasis on employment. This was a virus that made a distinction between those who can work through Zoom and those who can have to work physically, and consequently, the frontline workers that had to go out were more likely to get infected, and as a consequence, who had those jobs, etc. So that's one mechanism. But there are many other potential mechanisms that she sort of mentions, but we don't have the evidence, the precise evidence of, it does biological diversity play a certain role? And if so, maybe if people are diverse in some way, maybe they have to be treated differently, and maybe we have standard treatments that work in some populations and not in other populations, and we don't know what those relevant distinctions are. So I think this agenda is very important to figure out, I think to make more precise what is the mechanism through which these differential mortality rates are operating. It could be through work, but then people get infected at home, and that depends on the household composition. So what's the evidence for household composition? Or what happened in many parts in the US and especially in Spain is that the people were living in retirement homes, and death rates in retirement homes were huge. They were not stopped by quarantines because everybody will, they got sick where they live, right? So the transportation system is an important element. The rich in many places go on their own cars, and the poor go in buses, and etc. Or the retail system. There's this paper by Hugo Ñopo in Peru that argues that the people who don't have refrigerators at home, they have to go and purchase food more frequently, and it's in those frequent purchases outside that they probably get infected and so on. So what are the mechanisms is really, really important to figure out what are the policy implications. And finally, I really like very much Adnan's paper. The importance that this crisis leaves us is with the the importance of state capacity. And the things that limited state capacity, he emphasizes, these silos across professions, epidemiologists that don't talk to social scientists and economists and so on. And he puts a great emphasis on the idea that we need to learn. That when confronted with a situation like this one, what hits you is the ignorance with which you are confronted and asked to act upon. That you know that you don't know, but at least knowing that you don't know is so fundamental in organizing yourself, because now you know that you have to first or create mechanisms to learn so that you can respond with more knowledge that you're going to acquire as you act. So for example, at the beginning, we did not know how the disease was being transmitted. So I think of one prime minister who said, no, I'm going to go and visit all these people who are sick. Don't worry, I'm going to wash my hands, right? And then he got sick, right? So it's not knowing exactly what the transmission mechanism is. Do masks work or not? Well, we didn't know that at the beginning. What social distancing measures actually work? This is remarkably important because there have been devastating economic effects of social distancing measures, especially the ones taken in the second quarter of last year. Devastating economic effects. You had, dramatic collapses in employment in countries like Colombia, Peru, Argentina, etc. At the time when there was no contagion going on. But then, they reopened and immediately they got these peaks. And at the time, there was no longer the capacity to impose the same kind of social distancing measures. So in my part of the world in Latin America, we had the costliest lockdowns with very, very low effectiveness in terms of limiting transmission. For example, you look at differential declines in mobility and differential declines or controls of epidemiological peaks. We don't understand why South Africa has had 2 peaks and was able to bring them down very swiftly, and Latin America has had these, highlands of peaks. Where you get to a peak, but that peak is a highland, and it goes on forever and ever, and you lock everything up, and the peak doesn't come down. So we don't know what would have been a more effective way of implementing social distancing measures. And the way to do it is to be constantly, as Adnan suggests, constantly being accumulating data so that you can learn about the relative effectiveness of the things that you're making, the things that we are deciding. I'm sure that, for example, in some countries in Latin America, they said you can only go out shopping on 2 days or 3 days a week, and all the same days. Well, what happened? You bunch people up in stores and maybe enhance transmission, then reduce transmission. But there's no mechanism for you to, even if you make that mistake, to learn that you make that mistake. So there's a lot of this idea of learning to learn and creating the data infrastructure and the access to the data. Because, I throughout the pandemic, I was talking to ministers of finance, telling them, okay, let's work on, you cannot assume that the epidemiological side is going to be decided alone by the Minister of Health, because it's going to have enormous economic impacts. Let's get our hands with some data. And the data was not accessible to the ministers because the other ministers would not share. So this definitely, this coordination and silos that the paper refers to is very, very real. There is a dimension of policy that I'm sure is in the other papers, which is about the macro response. The big difference across the world is in the ability of the government to compensate or to protect people during the downturn. Countries differ enormously in the fiscal space they have and the ability to mobilize resources. In the US, for example, it's well known that the amount of social transfers were such
Thank you, Ricardo. Thank you very, very much indeed. I know you have to go shortly for another event, but I will make sure that the panel respond to those points, even if you aren't immediately here to hear their responses. First, though, I want to turn to the questions that have been put to us from members of the audience who've been very patiently waiting for their turn to come. So I'd like to put a question from members of the audience to each of Lucinda, Chico and Adnan. To Lucinda first, from Tracy Birej. Do you think the UK government has done enough to account for the unequal COVID-19 impact on mortality or the economy across ethnicities in regards to the types of interventions they've implemented to overcome vaccine hesitancy? Because the most impacted groups appear also to be those who are most vaccine hesitant. And then a question for you, Chico, from Tony Hockley, a visiting fellow at LSE. A full lockdown appears not to have been part of the playbook for pandemic response in some countries, but lockdown spread from China as the policy benchmark, as Professor Khan said, go big and fast, with no welfare impact analysis. Now that lockdowns are part of the pandemic toolkit, is it inevitable that countries will be better prepared for unequal impacts? And question to you, Adnan, from Angus Chapman, who's a master's student in the Department of Government here at LSE. How can state capacity elucidate why some countries performed well in different phases of the pandemic, or differently in response to the same kinds of challenges? Australia, for example, performed extremely well in containing the pandemic and minimizing community transmission in the early phases, but has struggled to manage the vaccine rollout. The exact reverse is true for the UK and the US. So I'll come to each of you in that order. Lucinda first.
Thanks very much. So yes, so has the government done enough? And I think it was particularly in relation to vaccine. So my vaccine hesitancy, which as was noted by the questioner, vaccine hesitancy is seems to be greatest, or has been shown to be greatest among those who might be most vulnerable. So particularly minority ethnic groups have shown a lot of vaccine hesitancy. We see this in the opinions and polling, and we also see it in actual take-up rates of vaccines in local areas. So, I mean, I think one of the issues here is and it picks up on something that Adnan was saying, is about sort of trust. So I think the government doing something is maybe not what is going to help here, because of some substantial loss of trust in the government. So there's been a sense of being let down, I think, by a lot of ethnic minority communities in relation to some of the reports that have been done, the handling of the Public Health England report into inequalities in COVID, which was very, very oddly handled, and got people very upset. And then more recently, the Commission for Race and Ethnic Disparities report, which again was felt to be by many to be simply sort of quite insulting. So I think trust in government is not at a high level. I think what has been done to try and address this vaccine hesitancy has been much more effective at local level by community leaders. So there's been a huge amount of creative activity. It hasn't solved the uptake problem, but I think it's done quite a lot to address that. And I think what we've seen is that reported rates of vaccine hesitancy were higher than actual non-take-up. So I think that the way to go in relation to vaccine hesitancy is much more local routes, those who are trusted, and to build that. There are, of course, things that government can do for other issues, but I'll let the other speakers come in because I don't want to.
Thank you, Lucinda. So Chico, lockdowns now part of the pandemic toolkit. It's inevitable that countries will be better prepared for unequal impacts going forward.
Thanks. So that does go, of course, outside the specific remit of my paper. So I'm speculating a little bit on the basis of reading other work rather than this particular work. But two things about lockdowns that I would say. The first is that, as with many other things, the devil is in the detail, and it matters tremendously how the lockdown is implemented. And the different kinds of countries are able to do lockdowns differently and benefit from them differently. So I think an illustrative comparison is one between China that was mentioned by the questioner and Peru. So China, zoomed in very quickly on Wuhan, despite taking some time to acknowledge the severity of the situation initially, but then was able to lock it down and using quite draconian measures, which some people may be quite upset about and say that they violate basic freedoms, but they were able to keep people in their apartments and enforce the lockdown in a massive way. Peru had a very big lockdown that they were not able to enforce. 60% of the labor force in Peru or thereabouts is informal. Prolonged lockdowns meant these people just had nothing to eat, so they went out to work and they went out shopping. And as Ricardo was referring to Hugo Nyopo's paper, if they don't have refrigerators, they have to go out to shop very often. And this is the case for many people in poor countries. So just to say that, lockdowns come in very different varieties and their outcomes are dramatically different, which is probably an obvious thing. The other thing I'll say about the last part of the question, which is now that they're part of the pandemic toolkit, is it inevitable that countries will be better prepared for the unequal impacts? I'm not sure. I mean, I actually think lockdowns, being a blunt tool, are very unequalizing in themselves, particularly in poor countries, because they create or exacerbate this massive new inequality between people who can work from home for prolonged periods of time and people who cannot work from home. And in poor countries, we will have no access to unemployment benefits or any other sort of social security. And therefore, in the informal sector are very highly exposed to having to go out, break the lockdown, or other inequalities like some of the ones that Lucinda mentioned, which are even more extreme in poor countries. So she referred, for example, to crowded housing. So if you think of trying to live in a lockdown in a favela or a big slum or a township in South Africa, where in addition to very crowded conditions, you also have very poor access to clean water and sanitation, you can imagine what that does. So I think the lockdowns, may have been necessary in some places, but in some other places they were implemented badly. India is another example where no account was taken of what migrant workers in the cities would have to do and how they'd have to respond. This is something Adnan knows a lot more about than I do, but my sense was that lockdown was mismanaged in the way it was announced and implemented. So A, they vary dramatically. B, I actually think they, in some sense, contribute to some of the new forms of inequality that the pandemic creates and exacerbates.
Thanks, Chico. So Adnan, on to you.
Thank you, Tania. Great question to which I don't have a great response, except for saying maybe it's too early to tell. But this is one of those several puzzles of that COVID policy response has thrown up. Our colleague Tim and Sasha in the parallel paper in the volume also highlight many of these puzzles. One of those being that countries with good institutions, by which I mean countries with strong executive constraints, elections, regular elections, and more citizen freedoms, seem to have performed worse, at least in the early stages of the pandemic. Whereas countries, some of those with authoritarian, maybe competent authoritarian governments, with higher interpersonal trust and confidence in the government seem to have done well. The way I at least find fascinating as something that needs to be unpacked is state capacity is not just a function of what exists on paper, call it installed state capacity or potential state capacity, but it's also call it an outcome of politics, state response, by which I mean the response of different players within the state, citizen response, voluntary action, and how much do they comply, and what I call earlier active learning. So unpacking all of those would be a rich agenda for future, but let me end on one thing, which is my primary area of interest, developing countries and emerging economies. An open question still remains whether this pandemic will prove to be an inflection or a turning point for the building of state capacity and institutional reform in developing countries in a way that the Great Depression and the World Wars did for many of the OECD or richer countries. My initial reaction is I hope very much so, but it doesn't look likely in many places because of the divisive and polarized nature of the politics, and because of the fact that at least in some of the places, states may or may not have taken the right lessons in terms of building their state capacity and building capacity for learning in future.
Thank you, Adnan. Okay, let's go for another round because there are more questions coming in. So first of all, to Lucinda from Evelina Hristova from LSE. Could you please elaborate more on the policy implications, i.e. with respect to labour markets and intergenerational transmission of disadvantage? Secondly, Chico, I wondered if you wanted to come back to Ricardo's challenge to you, which was, as I understood it, basically it's too early to say, and in fact these welfare impacts overall may reverse when we look at the course of the pandemic as a whole, beyond the end of 2020. Adnan, I have a question for you from Tony Hockley, LSE Visiting Fellow. How much of a conflict is there between the need for more adaptive learning, public policy responses to events, and sustaining public confidence? Okay, so back to Lucinda.
So policy implications, yeah. So I think, I mean, there's a lot here about sort of breaking negative cycles, but also about supporting sort of positive cycles. So I would start by saying that the story is not all negative. You know, I'm saying that there was quite a lot of intergenerational persistence, but there's also been a lot of change. There's been a lot of upward social mobility across ethnic groups, and there's largely created by education. And I think, you know, sustaining those successes is going to be important for policy. So one of the things that I didn't talk about, but I think is going to be a really important issue to look at going forward, is whether there have been specific impacts of the school closures on educational attainment. So educational attainment is now very high across minority groups. And is much less sensitive minority groups to economic background as well, and whether that will be sustained. And if it is sustained, then there is something of a potentially as positive story. If it's not sustained, then policy will really need to address that. In terms of the labour market, I mean, there are a number of areas that we can think about. There's some very specific areas such as self-employment. I think there has been an appetite among the self-employed themselves to be much more brought into national insurance systems to provide them some support in times of crisis. So there's relatively, sort of in the scale of things, relatively straightforward about issues about how you provide economic support in times of difficulty, in times of economic shock for those who are self-employed and therefore more vulnerable. There are other areas where you can think about how those who are more vulnerable will benefit generally from policies. I mean, the anti-poverty policies before 2010 were actually really successful in reducing child poverty, particularly for those groups that had highest rates of child poverty. So it's possible to do. Policy can address poverty. It can use universal levers like the minimum wage, but which will disproportionately affect those who are most marginal. And then there are areas around sort of more very specific policies. And one that I keep going on is this issue of no recourse to public funds for those who are subject to immigration control, which means that they can't get support from the state if they have to be out of work for a reason. And this has been talked about a lot. I mean, I've just been amazed how much this has now been talked about in a lot of contexts. It hasn't been acted on, but it could potentially be. And the sort of the counterproductive nature of such policies can be seen in, for example, the finding that those care home workers, those care workers who were more likely to transmit infections were those who didn't have any sick leave entitlement. For example. So you immediately start to see the benefits to everybody of having a better safety net. And finally, then I think yes, so that's more about sort of on the immigrant side. And finally, I think we need to think about the kind of valuation of different sorts of jobs where people are clustered. The whole social care crisis that we have and the valuation of social care is a nettle that the government seems to be doing the opposite of grasping, and how long that can be sustained, I don't know, but that would be a very valuable one to grasp and help to addressing some of these issues.
Thanks, Lucinda. So Chico, it's all too early to tell.
Yeah, no, I absolutely agree. It is too early to tell. The review wanted to put out an issue early. And there was this tension, I guess, that Ricardo himself recognized between trying to do some work early that can still be informative, but it's clearly too early to make definitive assessments. So, in the end of our paper, we have a bunch of caveats, and one of them is the pandemic is still ongoing and the distribution of poverty and mortality burdens may be very different in the future. I completely agree with Ricardo's comment in that regard. So, as I emphasized in the beginning, this was a snapshot up until December 2020. I think if we redid it now, it would already look different given what happened in 2021. And I think if we do it a few years from now, it will be more different still. Just one quick point on his, he mentioned the two sides, right? He mentioned the health side of the vaccines and the two ways in which you can develop immunity. And he mentioned the IMF forecasts and how they're going to look different in 2024. Of the two, I think the first is really more important for our paper because economically, we find that the richer countries were doing better anyway, remember, because we look at poverty, not at recessions overall. So there's a difference there. But the reason rich countries had such a large share of the mortality, of the burden of the pandemic in our work was because we were using these life years lost. And, because, Adnan had this great comparison of the demographic structures, the population pyramids of Italy and Pakistan. I mean, that exemplifies why we find that effect, is that the pandemic is much more, kills much more at the higher ages, as I said before. And so that's now that over time will stop being the case because the rich countries will get the vaccines and the poor countries are not getting the vaccines. And so long as that is allowed to persist, which is a policy variable, both domestic and international policy variable, then that can go away. The economic things, if you look at poverty as we did, I don't think it'll make that much of a difference, really, because, you know, as I said, the richer countries are already doing better in our analysis. It's really the vaccines that are going to shift the analysis that we did, and I think Ricardo is right about that.
Thanks very much, Chico, and thanks for keeping it brief. So Adnan, the public doesn't like it if the government changes its mind. So how do we combine adaptive policy making with retaining public confidence?
Personally, I do not see a conflict between adaptive learning and sustaining public confidence. It is true that governments need to project confidence, and sending mixed signals is not great for coordination and for their public image also. It is also true that some of this pressure to have strong, stable policies come from the press and from opposition, from our system, and sometimes of the citizens. Imagine a government saying we don't know, and the reaction would be, you don't know what you're doing. So a lot of pressure comes from the system, but at the same time, governments could do much worse than holding on to a particular line in the face of evidence. In other words, some degree of humility and some degree of embracing the concept of learning and being open and transparent with the people, treating them as adults, trusting them, and sharing with them some of your constraints is always a great strategy for sustaining confidence. The other extreme is we have seen so many leaders, macho leaders around the world, who have pretended that they know all the answers, who have projected maybe a false degree of confidence, and look how low they have fallen. Many of them, perhaps most of them have fallen, and unfortunately in many parts of the world. Let me also mention, this is also related to the question of the relationship between politics and scientific expertise, evidence, and where one should rely. And whereas the pandemic has forced even governments that were denying scientific knowledge and evidence to rely on scientific experts, at least to some extent. In some cases, maybe not with their hands on their hearts, more so for instrumental reasons for public consumption. It is true that policy needs to be based on evidence and scientific expertise, and when the evidence changes, obviously policy also needs to respond and be updated. But in the end, political decisions are ultimately the domain of politics. They have to be taken by politicians, and policy cannot be outsourced to experts and to scientists. In other words, in short, like being honest and sharing your concerns is a much better strategy for sustaining public confidence rather than projecting it falsely.
Okay, thank you very much. So I did promise Ricardo that I would give all the panelists a chance to respond to his comments, and I'm conscious that so far I've only invited Chico to respond. So perhaps, Lucinda, you would like to reflect on what Ricardo's comments, particularly on your paper, where he was interested in what you thought about the mechanisms that lay behind, and he mentioned a range of possible mechanisms that you might want to reflect on. And Adnan, Ricardo was asking you to think about the importance of the macro response in part, and where that fitted in, and the concept of learning to learn, which you very much welcomed in your presentation. So if I can just ask Lucinda and Adnan to respond to those. We do have many other questions, very interesting questions in the Q&A that I haven't had a chance to put to the panel, but I think that will unfortunately take us up to time. So Lucinda and then Adnan.
Thanks very much. Yes, so mechanisms. So one of the mechanisms was raised was whether there's sort of biological factors here, because we're talking about different mortality rates across ethnic groups. There was a lot of interest initially in whether vitamin D might be a culprit in greater risks from COVID-19. There has been investigations of that. There's no evidence that vitamin D plays any sort of role in that. There is no good evidence for biological factors, and there seems no particular reason to resort to them when we have sort of plenty of other mechanisms, and when also it would be tricky to explain the differences between South Asian groups, for example, and the differences between Black groups if you were resorting to a biological explanation. So the other things that were raised were whether there are sort of household level factors, and I think I mentioned there has been research. There's been research using different data sources which have shown that multi-person households seem to increase infection rates and also increase mortality rates using different data sets to get those findings. So the household clearly does matter. It doesn't fully explain differences across ethnic groups, but it clearly is. There is good evidence that it is a risk, so it's a viable one. There are a number of other areas were raised in relation to work and to the experience of work. And again, I mean, one thing that I was very struck by was the average age of death was substantially lower for Black Africans in particular than it was for white, the white majority. Which to me suggested that this reinforced an explanation that this was happening at work, at least to some degree, and was happening at work more rather than out of work. And then one of the issues, though, of identifying mechanisms sort of categorically is that actually we don't have vast numbers of deaths. I mean, they seem very large in one ways, but if you're breaking down and looking across ethnic groups, we don't have vast numbers. So some of it has to, I think, be slightly inferential in this way because we can't fully test and we don't have all the factors. But I think there has been a lot of testing of mechanisms, and I think there's good support for that. I think what hasn't been done so much is breaking down by the generations and thinking whether there's sort of immigrant effects and then there's second generation and whether they're consistent across the two. And I think that would benefit from being looked at. So I'll leave it there. Thanks very much indeed, Lucinda. Adnan, brief word, please.
Yeah, I agree with this comment. There are other people, especially Andres and others, who will talk more about the micro response. The only thing I will say is when it comes to developing countries and emerging economies, the macro response not only of their domestic policy responses, but also how the international community responds will determine to a large extent how whether this short-term crisis has permanent long-term scars or not. And at least at the initial stages of this crisis, many of the rich countries were, the response that we saw was every country was basically taking care of its own interest. Let me stop here.
Thank you very much indeed. Indeed, thank you everyone for your participation today. Sorry if I didn't get to your questions in the Q&A, but thank you for attending and for your participation. Thank you, of course, to our speakers, Francisco Ferreira, Lucinda Platt, Adnan Khan, and Ricardo Hausmann. Your papers are available in the LSE Public Policy Review if people want to look at the more extended treatments of the subjects that you've been looking at and talking about today. The link to that issue is in the chat, ppr.lse.ac.uk. And you will also find in that issue an absolute bumper crop of other papers dealing with aspects of the COVID-19 crisis and policy response, including Angus Deaton on global income inequality, for example, Tim Besley on trust in institutions, John Jackson on motivations to comply with lockdown, Claire Wenham on lack of gender-informed policymaking and its implications, and so on and so forth. So I hope that we have whetted your appetite. Thanks again to the speakers for your very stimulating papers and open response to the questions. And thank you, participants, for your questions today. Bye-bye, everybody.